girls, it's me, Sarah. I just wanted to come on here and do an update because it's been so long. It's probably been over 2 months, 3 months. I am currently 12 weeks and 3 days. Have a prenatal appointment tomorrow. Get to see my baby, hopefully. I ended up having to switch hospitals and OB clinic because I had a big old problem with the one I was at before, and I was being seen there since when I found out till maybe about 11 weeks. So I've been waiting for this 12-week appointment. So far, pregnancy's been off and on hard. I am high risk. I have high blood pressure, and I do have diabetes. I had borderline diabetes before I got pregnant, and so now that I'm pregnant, it's going a little bit over. But because I'm not that far in my pregnancy, it could get worse where I would have to take insulin. I did keep on the metformin that I was taking when my RE had gave it to me to help me get pregnant with the Clomid and the Provera. He had gave me 1,500 milligrams, and I'm still on that, but they don't want to give me any more metformin. So if anything gets bad with my diabetes or I can't control it, I'm going to end up on insulin, which I really hope doesn't happen. My blood pressure right now, I was on blood pressure meds for 6 years or maybe longer. And then in July of this year, they had took me off because my blood pressure was dropping low and I really didn't need to be on them, I guess, anymore. And they monitored me for like 3 or 4 months without being on them, and I was fine. So I haven't been taking them. But now that I'm pregnant, I guess for being pregnant, it's high. The highest I've had it is like 137 over 80 or 89. So, I guess that's, what they really don't want to see it that high yet. But it could get higher, as time goes on throughout my pregnancy. So I have all those issues. And then I have anxiety disorder, which I've been on anxiety meds off and on for like the last 3 or 4 years. I got off of those in July also because I didn't want to. I wanted to try to be off of anxiety medication while trying to have a baby, even though I was already trying for 2 or 3 years before with the medication. But after all these commercials with having the birth defects with all the medication for anxiety and depression, I was like, I'm not going to do it anymore, So I got off it. But I noticed that now that I'm pregnant, my anxiety's coming back. So I'm trying to fight it my best that I don't have to take anything throughout pregnancy, because that's like, I don't want to do that at all. So, I've been working through it, trying to find ways to, keep my mind off of worrying about things. And I did have a little scare in the beginning around, I think it was 7, 8 weeks. I had some brownish, orangish discharge. Doctors said that, most women do have spotting within the first 12 weeks of pregnancy. So, after that, I had a couple ultrasounds and the baby was fine. And I've been able to find my baby's heartbeat with my home Doppler, which I've been able to distinguish my heartbeat from my baby's heartbeat, because the baby's heartbeat is way faster than mine, of course. So that's been reassuring me, making me, be okay with my anxiety. Plus my husband helps me, my family does help me out, knowing that I have this, disorder and stuff like that, because I also have post-traumatic stress disorder because I witnessed my uncle die from a massive heart attack. So that's kind of like, still in the back of my mind. It's only been 2 years, but I've been learning to deal with it, you don't forget, but you learn to move on. So, I'm moving on with that. I have my little, what you would call pregnancy worries, am I going to be a good mother, am I going to be able to take care of my baby the way I need to, and I don't know, it's just worries, even though I know I will. It's just, you start thinking that stuff, and it's, I know I won't be a good mother. Everybody knows me and how nurturing and loving I am, but I get worried sometimes. I don't know, I worry about everything. So yeah, and then I'm having the early gender prediction scan, which is going to be 13 weeks. I guess 13 weeks is like one of the earliest times you could find out. I mean, it's not 100%, but it's like close to 100% accurate. And I know my sisters had it, her best friends had it, and my sister's sister-in-law had it, and they were all accurate. I mean, they had what they told them they were having. So I'm having that done December 1st, and I can't wait, because I mean, regardless of what it is, I'm going to be happy. I'm happy that I'm pregnant. You know, it's a blessing from God that I'm even pregnant. Like, I never ovulated before this, and it was meant to be. So I'm so excited about it. My due date is in June 8th. I mean, that could change. I don't know. I haven't had a growth scan since finding out. So baby could be measuring bigger or smaller. I'm not sure. I will be 13 weeks, like I said, December 1st. And then, because this is a new doctor, I'm going to have to go through tomorrow, like, probably medical history and everything all over again, which is fine with me, but as long as I can get another ultrasound in. Because, like I said, I haven't seen my baby since maybe, like, 7 or 8 weeks. Being high risk, I know you get more ultrasounds or whatever, because, they always want to monitor the baby. As far as, like, thinking what I'm going to have, I don't know. Everybody keeps telling me they think I'm going to have a girl because I'm so totally opposite from, like, my brother and sister. Because my mom, like, when she had us, she had my brother first, then me, then my sister, a boy and 2 girls. And then my brother, when my brother and sister-in-law had their first kid, it was a boy, and then they have 2 girls. So, like, my mom. And then my sister has a boy, and then she has a girl. But they say because I'm totally opposite, like, they're tall and skinny, and I'm short and chubby. So they think because I'm, like, totally opposite from the way they are and, like, their personalities and stuff, that I'm going to be the one that has a girl first. Which, hey, if I do, I'll be happy regardless, But in the back of my mind, I kind of feel like it's a boy. Like, I mean, come on. Like, how it fell with them, like, it might fall like that with me. I don't know. Maybe I'm just being, I don't know how you would say it, but I don't know. I just feel like I'm going to have a boy. Either way, I'm going to be happy. My husband thinks it's a girl. So I'll be surprised if it is. What else? Oh, I already had, like, some of my genetic testing done. I'm not going to do an amnio. I mean, the only reason why I did some of the genetic testing is because of my husband. I know there was a couple little genetic things in his family. I'm going to find out probably in this appointment tomorrow if those results had came back, because that was at my other doctor's office right before I had left. So hopefully they already had got my results with my chart transferred. So I'm hoping those come out negative. But as far as the amnio, I will not let somebody stick no needle in my stomach. I mean, there's a chance of miscarriage with that, and I mean, I don't know how far, a chance it is, but I don't want to risk anything, period. Whatever, if my baby comes out Down syndrome, it comes out, with any type of birth defects, regardless, I'm going to love my child. I worked with people with developmental disorders my whole life since, my aunt worked with them her whole life, and I've grown up basically around a lot of clients. And so, I mean, nothing prepares you for your child to have a developmental disorder, but like I said, I've been around enough people with these disorders to know how they are. And I've been around children. Most of the ones I've been around are adult, but I've been around children too. So I know I would be able to handle it, I mean, of course, it's going to be hard because that's your child. You don't never expect it. But if it happens, it happens, So, yeah, no amnio for me. And I'm hoping like hell when it's my time for this baby to come that I end up having, a vaginal birth. I don't want a C-section. My sister's had C-sections twice, and I've seen how hard it is for her, and I'm already a big girl, so it's like I know it's harder for bigger women to have C-sections because it's like, the healing process is a lot harder, I heard. And with her, I mean, she skinny as hell, and she had a hard time with like the pain and everything like that. In the beginning, she couldn't even breastfeed her baby because she was taking a lot of pain pills because of it. I mean, some people can deal with pain and some can't. So, I mean, I'm kind of scared about that, but if I had to, I have to. There's no doubt about it. So yeah, I mean, I haven't really like figured out like people like doing birth plans and stuff like that. I really haven't figured anything like that out yet. I'm just trying to take it like one step at a time. Oh, one thing I wanted to say is that I'm kind of scared about is because I have really problems with my sinuses already. Like, I always have sinus infections, head colds, stuff like that, and I'm already starting to feel out of breath. I mean, I already feel out of breath because of that. Like, I feel like I always breathe out of my mouth and I can't breathe out of my nose. And so now that I'm pregnant and I'm gaining, no, I mean, I haven't, and that's another thing. Oh, that's another story after this. I feel like I can't, like, it's hard for me to breathe already, and I'm not even that far. But I don't know. Hopefully I guess it's all in your head, Reverse psychology on it. Rebuke it. But, oh, and then, I've lost like over 22 pounds since finding out that I'm pregnant, and it's like freaky, like 22 pounds. I couldn't even lose weight by myself, period. And now that I'm pregnant, I've lost 22 pounds, and I haven't gained any weight. Like, I'm still stuck at the weight that I lost, which I know, like, when I'm like in my probably the second, third trimester, I'm gonna blow up. I already feel it, but I haven't gained any weight at all. Even though I feel like I have a baby bump, like, I'm not gonna show you because I'm just a fatty. I mean, I have not gained at all. And they kept saying, well, if you lose any more, we're gonna have to, send you to a dietitian, even though they already do because I'm diabetic. We're gonna have to make you see a dietitian. I know it's hard because you're so nauseous in the first trimester and you're probably not eating as good as you need to, and blah 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 blah. So hopefully, I mean, for just for being healthy for my baby, hopefully I gain the weight that I need, not extra. But man, I'm already a big girl, so it's like I feel like, well, the baby's just gonna fill out what I already have. But anyways, so yeah, like I said, I just wanted to make this vlog because it's been a long time, and I know a lot of people were viewing me and watching my YouTube channel, and I know I've given a lot of you guys in the dark. I'm so sorry about it. I mean, some of you guys follow me on Facebook, so off and on things I've posted. So anyways, I will try to post an update tomorrow regarding my appointment, and if I get any ultrasound or anything like that, I'll let you girls know. And I will talk to you girls later. Alright, you guys just keep in touch, and I do still watch your guys' videos, so don't think I don't. And anyways, I'll talk to you later. Bye.